Hey guys, this is FixerMed. Welcome back to my ECG Skills Builder Workshop, where I will be covering all of the fundamental knowledge and skills you will need to read and interpret an ECG in a quick and effective manner. This will be part 12 of my multi-part video series of doing so. Today we will be tying together everything we have covered so far and take a look at how to calculate a heart rate from an ECG and how to examine a heart axis from an ECG. Without any further delay, let's go ahead and get started on today's content. Let's take a look at the key elements of ECG interpretation. Rate. Determining the heart rate is crucial for assessing cardiac function. Rhythm. Identifying the origin and regularity of the heartbeat helps diagnose arrhythmias. Cardiac axis. Analyzing the electrical axis of the heart provides information about the overall direction of electrical conduction. Abnormalities. Recognizing abnormal ECG patterns is essential for identifying potential cardiac problems. All right, moving on. Let's take a look at heart rate calculation. Locating the QRS complex. Identify a QRS complex closest to a dark vertical line on the ECG paper. Counting the distance. Use the numbered lines. 300 million, 150,000, 100, 75, 60, 50, 43 to determine the distance between two consecutive QRS complexes. Applying the rule, divide 300 by the number of large squares between QRS complexes. Example, if two large squares separate the QRS complexes, the heart rate is 150 beats per minute, 300 divided by 2. Now let's take a look at the ECG to the left. In this ECG, we can see that the QRS complexes are separated by 3.4 large squares, 3 whole large squares, and 2/5 of a large square. Therefore, we can calculate the heart rate to be approximately 88.235 beats per minute. 300 divided by 3.4 equals 88.235. Now let's take a look at heart rhythm analysis. Source. Determine if the rhythm originates from the sinoatrial SA node normal pacemaker or an ectopic pacemaker. Regularity. Assess the consistency of the intervals between heartbeats. P wave and QRS complex. Relationship. Analyze if a P wave precedes each QRS complex and if the P wave morphology remains consistent. This helps identify normal sinus rhythm or potential arrhythmias. Ventricular fibrillation, VF, is characterized by chaotic electrical patterns, resulting in irregular spikes on an electrocardiogram, ECG. Now let's take a look at the cardiac axis. Understanding vectors. The cardiac axis represents the sum of electrical vectors generated during depolarization, indicating the overall direction of electrical conduction. Normal axis. In a normal heart, the electrical impulse travels from the SA node, top right, to the Purkinje fibers, bottom left, resulting in a downward and leftward vector. This typically leads to positive deflections in leads 1 and AVF. Axis deviations, right axis deviation, RAD, may be seen in tall, thin individuals, right ventricular hypertrophy, pulmonary embolism, or congenital heart defects. Left axis deviation, LAD, may be observed in shorter, heavier individuals, left ventricular hypertrophy, or conduction abnormalities. Moving on. Here's a nice visual aid to illustrate the cardiac axis and a summary table of each deviation classification summarized in a table. Be sure to add these to your notes for a better understanding of these concepts if necessary. All right, moving on. All right, let's take a look at pathways of depolarization and axis deviations. Normal conduction, depolarization wave spreads through the heart via specific pathways, resulting in a normal axis. Bundle branch blocks. Blockages in the conduction system can lead to axis deviations. Right bundle branch block, RBBB, causes right axis deviation. Left bundle branch block, LBBB, causes left axis deviation. Left anterior fascicular block and left posterior fascicular block can also result in axis deviations. Moving on. All right, let's take a look at the left bundle branch block and the right bundle branch block. ECG characteristics of a typical left bundle branch block shows wide QRS complexes with abnormal morphology in leads V1 and V6. ECG characteristics of a typical right bundle branch block showing wide QRS complexes with a terminal R wave in lead V1 and a prolonged S wave in lead V6. All right, let's take a look at the left anterior fascicular block and the left posterior fascicular block. Left anterior fascicular block, abnormal left axis deviation, usually between 45 degrees and 60 degrees. QR pattern, small q, tall r, in the lateral limb leads 1, and AVL-RS pattern, small r, deep S, In the inferior leads 2, 3, and AVF delayed intrinsicoid deflection in lead AVL, greater than 0.045 seconds. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. Which aspect of electrocardiogram, ECG interpretation, is vital for assessing cardiac function? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. Determining the heart rate is crucial for assessing cardiac function as it provides information about the frequency of ventricular contractions per minute, which is essential for evaluating the efficiency of cardiac output and overall cardiovascular health. Therefore, the correct answer is A, rate. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B, rhythm. While identifying the origin and regularity of the heartbeat is important for diagnosing arrhythmias, it focuses more on the pattern and consistency of heartbeats rather than the overall function. C, cardiac axis. Analyzing the electrical axis of the heart provides information about the direction of electrical conduction, but it does not directly assess cardiac function. D, abnormalities. Recognizing abnormal ECG patterns is indeed essential for identifying potential cardiac problems, but it is a broad category that encompasses various aspects of ECG interpretation, not specifically focused on overall cardiac function. E, electrical conduction. While electrical conduction is vital for the proper functioning of the heart, it is one component among several others in ECG interpretation and does not solely determine cardiac function. All right, now that we have covered this question, let's move on to look at the next question. Which method is used to calculate heart rate based on the distance between two consecutive QRS complexes in an electrocardiogram, ECG? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. Applying the rule involves dividing 300 by the number of large squares between two consecutive QRS complexes on an ECG. This method allows for a quick estimation of heart rate based on the distance between QRS complexes. Therefore, the correct answer is C, applying the rule. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, locating the QRS complex. While locating a QRS complex closest to a dark vertical line on the ECG paper is an important step in ECG interpretation, it does not directly involve calculating heart rate based on QRS complex distance. B, counting the distance. Counting the distance between two consecutive QRS complexes using the numbered lines 300,150,175, 60, 50, 43 is part of the process, but it's not the method used to calculate heart rate. D, identifying the QRS pattern. Identifying the QRS pattern may involve recognizing abnormalities or specific characteristics of the QRS complex, but it does not involve calculating heart rate based on distance. E, measuring the ST segment. Measuring the ST segment is important for evaluating myocardial ischemia or injury, but it is not used to calculate heart rate based on QRS complex distance. All right, now that we have covered this question, let's move on to look at the next question. Which condition is associated with a downward and leftward vector of the cardiac axis in electrocardiogram, ECG, interpretation? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. In a normal heart, the electrical impulse travels from the SA node, top right, to the Purkinje fibers, bottom left, resulting in a downward and leftward vector. Left axis deviation, LAD, is observed when the axis deviates further leftward from the normal range, typically seen in shorter, heavier individuals, left ventricular hypertrophy, or conduction abnormalities. Therefore, the correct answer is B, left axis deviation, LAD. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, right axis deviation, RAD. Right axis deviation, RAD, is characterized by a rightward deviation of the cardiac axis and is associated with conditions such as tall, thin individuals, right ventricular hypertrophy, pulmonary embolism, or congenital heart defects. C, ventricular hypertrophy. While ventricular hypertrophy can influence the orientation of the cardiac axis, it does not specifically result in a downward and leftward vector. D, pulmonary embolism. Pulmonary embolism may cause right ventricular strain and subsequent rightward deviation of the cardiac axis, not a downward and leftward vector. E, conduction abnormalities. Conduction abnormalities may affect the direction of the cardiac axis, but they do not specifically result in a downward and leftward vector as seen in left axis deviation, LAD. All right, guys, that is all I have for this video today. If you like this type of content, be sure to leave a like and subscribe for more content like this in the future. Be sure to leave any questions, comments, or concerns down in the comment section below. This is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.